Okay, so I'm Mariah. I'm going to be showing my master research today, which is on pain control for the castration of newborn bull calves. The principal investigator for this project was Dr. Jessica Gordon, and I'm going to go be doing like a brief overview of background information, our objectives, the methods that we used, results, and then implications of this research. So, not every place in the world does castrate, but in North America we do. And the main reasons cited for this are for the improved meat quality, how it eliminates unwanted breeding, and also reduces aggression. In this study, we use meloxicam, oral and injectable, which is a non-steroidal anti-inflammatory drug to reduce pain caused by inflammation. Knowledge of castration in bee calves, there's currently little research. Most of it focuses on surgical castration. And then what is elastration? For those that don't know, it's where the rubber band is placed above the testes to disrupt blood flow, causing necrosis to occur. And then I have an image there showing the band applicator. Oops. So in Canada, we do have the Beef Code of Practice issued by the National Farm Animal Care Council. The revision of this code, that's originally from 2013, is currently underway with the public comment period starting March 2nd, 2026. But for the last several years, the requirement has been that bull calves 6 months of age or greater must receive pain control at time of castration. However, research in 2017 did show that in Ontario, 53% of cow-calf production survey respondents castrate shortly after birth, and in Western Canada specifically, 95% of Western cow-calf production survey respondents castrate before 3 months of age. So none of these calves would require you to give any pain medication. In the US, they do have the National Animal Health Monitoring System, which does survey data on beef cow-calf operations. And their survey results does show that majority of calves are castrated before sale, but there's no other specific age requirement that's listed on there. So for our objectives, they are to determine the behavioral and physiological effects of illustrating within 48 hours of birth and determining the effectiveness of different pain control regimens, which I will get to on a slide, which pain control regimens we use with the oral and injectable meloxicam. But there is a cost to mention between oral and injectable meloxicam. So approximately for a 40 kilogram calf in Canada, it's about 84 cents per dose of oral and $1.84 per dose of injectable. But these costs do not include like equipment and labor costs. So for our methods, the research site that we used was the Ontario Beef Research Center in Elora, Ontario. We had 85 singleton bull calves enrolled in this trial, and they were randomly assigned to one of our five treatment groups. And then this table shows our treatment groups. So in the column that has procedure, it just shows if they were elastrated or not. So our treatment groups were labeled 2 oral, which is 1 dose of oral meloxicam given at time of castration and 1 week later. 1 oral given 1 dose of oral meloxicam at time of castration. 1 injectable, so given 1 injectable dose at time of castration. Our sham group, so all these calves were handled as though they're being castrated, but they did remain intact. And our control calves, so they were castrated but given no pain control. And this control group is what represents like the current industry standards in Canada, as since there isn't a requirement for these calves to receive any pain control. Oops. So the research team involved, it was myself and three undergraduate students that collected the behavioral observations. Now, for the undergrad students, they were blind to the whole project. They didn't know the purpose of the study and the trial going on. I knew the purpose, but I myself and the undergraduate students were blinded to which calf was enrolled into which treatment group. So we did not know which calf received which, and we also do not know at the time which calves were castrated or not. So we were completely blind when taking all that um, recording all those observations. For our data collection, we did the behavioral observations. We also used activity data loggers and did the weight of the calves. So the calves were observed for a continuous 2 hour period over several days of the trial. We placed, what's shown in the image, onset observer by onset, commonly known as hobo data loggers, that were placed on their hind legs that measured standing time, lying time, and number of lying bouts. The photo in the red under the vet wrap, that gives an image of how they were placed. And then the weight of the calves, so they were weighed weekly until 8 weeks of age, and then they were weighed bi-weekly until weaning. And weaning occurred at around 8 to 10 months of age. and they were placed on pasture at that time as well. This is an image that just shows the timeline of everything. So from the in their first 16 days of life for each of the calves as they were enrolled into this trial. As mentioned, we did collect blood samples, which I will not be discussing, but I'm just showing them here as transparency so you know everything that the calves went through during their time in my trial. So an ethogram was constructed using past research on validated pain-specific behaviors. These are only 5 of the 11 behaviors recorded. The images show the difference between a normal and an abnormal lying posture. As you can see, the photo outlined in red, the calves' hind legs were fully extended. We see this posture occasionally, but the fact that we see it more frequently following castration, especially without any pain mitigation, is the reason these postures are identified as being abnormal. And at the bottom, I have my references for where we constructed this ethogram from past research. So results, I'll just briefly touch over this, the methods that I use. So I used SAS as the modeling procedure for this. And then for fixed effects, we had like castration, if they were castrated or not, medication, time, and interactions, and also a block effect by pen and pen by treatment, just so we had any confounding variables that were accounted for. This helps us explain why these animals may not all behave the same and accounts for difference factors that we just seen throughout our trial. And I am the person who did all the data analysis, and I was also still blind at this point, so I was still using the treatment group, like the treatment group labels as their categories during the data analysis. So for results, getting into the good stuff. So our sham calves did show the lowest rate of pain-specific behaviors, which as expected because they were not castrated. Our control calves did have the highest rates of pain-specific behaviors compared to all other treatment groups. Also, that aligns with our hypotheses since they did not receive any pain control. Control calves, just to put in perspective, had approximately 2 times the rate of tail flicks compared to our meloxicam treated groups, and also 3 times the rate of licking compared to our meloxicam treated groups. So next for our results, we have our general activity. So this is from those Hobo data loggers. There was statistical differences between standing time and control calves as they had like less time standing. You can also see that in the line chart as well. And this was put together to be a conclusion from the standing to lying period, like the movements between standing and lying may be causing discomfort from the band placed. And then also for average daily gain. So the line graph shows average daily gain from week 4 to week 8 for all treatment groups except for our sham calves because as per the research center's protocol, they were castrated after 2 weeks. So we did not focus on them for the average daily gain analysis of this portion. But as you can see, the control calves did have a decrease at week 5. This is around the time that the sawing off occurs for the scrotum. And then the table shows the average daily gain from day of castration to their weaning weight. So control calves did have greatest average daily gain to weaning. However, due to logistics, which I can also answer some questions on why the logistics played a role. This was one of our younger groups of calves, which I will also touch base on. So they were younger when they were weaned, and then during data analysis, there was a relationship between number of days from day 0 to weaning, which may explain the difference as to why the older calves in the other meloxicam treated groups began to plateau their weight, which should have an effect on their average daily gain when comparing from castration to weaning. So for our research summary, the meloxicam treated calves did show lower rates of pain associated behaviors compared to our sham and control group. As we know, castration is painful. This research just emphasizes that, showing that the use of meloxicam can alleviate some of this pain. The time spent standing was significant, with the control calf spending the least amount of time standing, but had the highest rate of standing and lying posture transitions. And as I mentioned, this related to position adjustment discomfort due to this also being seen in other studies. There was no difference in average daily gain, even though the changes to the study design, it may not be surprising if there was a long-term difference in average daily gain, as better animal welfare does not always line up with productivity. For the regimen standpoint, The two oral calves did show the lowest rates of pain-specific behaviors, which does align with our hypotheses, as this was the only group that did receive 2 doses of meloxicam. And then the one oral and the one inject group were similar. But then when comparing just the meloxicam treated groups together, it was the one injection group that had the highest average daily gain compared to the other meloxicam treated groups. For limitations, which brings me to the control group not being like they were the youngest and also not blocked by weight. So in beef production, there's a lot of research and studies that look at average daily gain, but a lot of them have a group of calves that are all the same age. At the research center, they're born over a span of 3 months. So we weren't able to start off with a large group of calves that we were able to sort into like least or small birth weight to largest birth weight. So this limited us to not blocking the calves. So that was just, what comes with the study and the research. And as previously mentioned, we did take blood samples but did not analyze them. And average daily gain should be analyzed alongside biomarkers. But average daily gain in general is an important factor to producers as you rely on productivity for market weights. So it's still included in the study. For practical implications, because research is what we need to do, but the next step after that is actually applying it into the field and using it. So, however, animal welfare logistics does play a role in implementing pain control. The oral route reduces the use of needles, so that's way less invasive. The calves would also not need to be as securely restrained. Some small scale farms may not have the equipment, such as portable chutes, portable calf chutes, or even the farm staff to secure a calf in to give an injection or a second oral meloxicam dose because they grow fast. Oral meloxicam, given either way, as we see, can alleviate pain, but oral would be preferred looking at a practical standpoint. And lastly, with these research findings, there are areas needed for further research, and research conducted on the external validity of these results can help us as researchers and people who are involved in the industry understand what challenges and limitations producers might be facing if they want to adapt a new castration protocol, or what might be limiting them to castrating at an early age and providing pain medication. But overall, using meloxicam on young calves when castrating has shown to minimize pain. There's no evidence that it impacts average gain, unfortunately, but we do have some evidence that it impacts pain, and future research should look at a more long-term standpoint of average daily gain, and if possible, getting calves of similar ages as well. So I would like to acknowledge OMAFRA and the Beef Farmers of Ontario for funding this project, as well as Solvet for the donation of the Meloxicam used. I'd also like to thank the Ontario Beef Research Center staff for their assistance, and also a special thanks to my advisory committee of the staff again, but a special shout out to Tyson and Tim and the research members of my team. And that's everything.